Well, hello and welcome into another edition of the Mind Your Business podcast here, presented by the Boone Area Chamber of Commerce, brought to you each week by our friends at Appalachian Commercial Real Estate and UNC Health Appalachian. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. With us this week, our good friend Wayne Randall, the Center Director for Blue Cross Blue Shield of North Carolina, their Boone Center on Highway 105 in the Greystone I building. Wayne has been popular on this program of late. I went back and checked, Wayne, and this is like the third time in 4 months you've been on here. We're going to just start naming this the Wayne Randall Hour. How about that?
Hey, sounds good to me, man. We certainly enjoy it, and we appreciate the time to be able to share with everyone.
Well, and we've got an important topic, and this is an annual discussion that we have had on Mind Your Business for as long as I can remember it, and that is helping people kind of come to terms with, understand, and be able to act on the open enrollment period for health insurance that is getting ready to start middle of the month. So we've got about a week or so, a little bit more than that, to make sure that everybody understands who's eligible, how they go about making any changes, what changes could be made at this point in time, and all of the fun information there. So Wayne, we appreciate Blue Cross Blue Shield of North Carolina always being so helpful during this period. This affects people whether they're Blue Cross members or not. And it's just good information to have as we go into one of those, I'll call it very important administrative times for life, but also for businesses that don't offer health insurance as part of your benefits structure. This is important information for you to pass along to your employees as well, so they can make any changes that they need to make. So Wayne, we'll get into the first part of this. Tell us a little bit about timing. When does open enrollment start? How long does it go for people to be able to make changes and make sure that their health insurance needs are taken care of for the next year?
Absolutely. Thanks, David. So open enrollment for our Medicare members, that is anyone 65 and older or even younger with certain disabilities and time on that disability. That begins on October the 15th and runs through December the 7th. That's a time where you can make changes to your plan. Even if you're with another company and you want to look at what Blue Cross has to offer, that's the time you can make that change as well. And then for our under 65 group, on the individual marketplace insurance, or if you don't qualify for marketplace, that open enrollment is from November the 1st and runs through January the 15th. The key about that one is if you want your plan change to start January the 1st, you have to have that completed by December the 15th. But you still are in good shape if you don't have time or get stuck and hadn't really decided. You can still make a decision up and through January the 15th. And then if you make that decision after December 15th, it would just be effective February 1st. So we want to make sure you have those times and dates to make sure you get all those plan changes in effect for that.
Well, and I know that this is a popular time too for people. You know, they see all of the advertising around and the communication around open enrollment, and that may, trigger something in someone's mind that says, hey, I lost a position a couple months ago and with that health insurance went away. I guess I must have to wait for this open enrollment period, but that's not necessarily the case. You do such a great job of describing what are life changes, some of that important insurance language. Can you tell us about some times of year or situations that you might not have to wait for a period like this to make changes in your health plan?
Absolutely. So with our under 65, and even with Medicare, so you can make changes anytime. Maybe you've moved to a different area. Maybe you've moved from a different state into North Carolina. You have 63 days to make sure you catch that insurance. It gives you a special enrollment period. If you lose a job that had health coverage and you're not going to have that health coverage, and it ends, you have 63 days from the last date of that policy being effective to enroll in your policy. If you're on our policy and you get married, you have that 63 days after marriage to be able to add your spouse, or if you have a baby, you can add your baby to your policy as well during that time as well. And then for Medicare, it works the same way. You have a few different other choices. So for Medicare, you can start signing up 3 months prior to turning 65, the month of, and then 3 months after you turn 65. And then again, another one is, you move to a different area. You'll want to make sure you you contact us so that we can make sure we offer the policy that, if it's the same policy, you can kind of stay on that. But anytime you move into a different area, you want to make sure your policy can stay in effect, or you have an opportunity to make that change as well. So just a lot of different life events that you can take advantage of as well. And of course, always open enrollment, making those changes for next year as well is a great opportunity to take a look at what your healthcare needs were this year and what you can anticipate for next year, so we can get the right policy for you.
I got to ask the question, man, what's so magical about 63 days?
Yeah,
There's got to be a reason, right?
there's no real magical to that. It just gives you that 63 days to be able to, maybe because of Sundays, they want to give you a little extra time in there, but not really heard a magical number of why 63 days.
Wow. Well, there you go. We'll see if by the next time we do this, we'll have a better answer to that question. We'll see. Well, this is a period again for the next several weeks. People that are getting ready to take advantage of this time of year and make some changes to their policy, be that Medicare customers or under 65, as you've mentioned, they're going to be dissecting different plans. And, what's the plan I'm on now? What benefits may be added to different plans? What can you tell us about any changes that you see in Blue Cross Blue Shield's offerings that may be worthy of letting people know about as they're trying to figure out what works best for them?
Yeah, absolutely. So we've lowered on many of our plans your maximum out-of-pocket expenses for your medical expenses. Um, we've lowered that, which is a very important tool there. We've given extra dollars on what we call our quarterly over-the-counter card. We've given extra dollars on some of our plans that way. We have some plans that offer a reduction on your Part B premium. So you want to make sure your plan's in that and take a look at all of those. And we have opportunities for you to get that information as well. We have renewal meetings starting this Friday, October the 6th. The renewal meetings you're already on one of our plans. You just need to see what's coming up for next year. We'll be going over all those plan changes at 10 o'clock every other Friday. Our first one is October the 6th. And then, of course, the next one will be October the 20th. You can call our center just to let us know you're coming, or you can just walk in. We prefer to know how many people's coming so we can make sure we're prepared for that. So if you can give our center a call, would be great. If not, that's okay too. Just come on in. And then we have a sales meeting. Whether you're needing Medicare for the first time or you're looking at maybe making a change, we have those every Friday starting October the 19th at 10 a.m. I'm sorry, not every Friday, every Thursday at 10 a.m. starting October the 19th. For those sales meetings, if you're new to Medicare and need to get some information, or you want to be able to come in and look at what our policies offer and make a decision based on that. So some great opportunities. If you forget all of those, just give us a call at our Boone Center, and we'll be glad to give you that information and help you decide when's a good time for you.
Well, and we'll make sure that Wayne gives that phone number to you before we leave this particular conversation here in just a few minutes. So go ahead and grab a pen and a piece of paper, and we'll get that to you in a second. Wayne, I know a lot of the questions that come up for people at this time of year, they try to get the best coverage. They try to get the right deductibles and out-of-pocket costs, all of those things to line up. But for so many people, it ultimately comes down to price. Especially with the under 65 crowd, knowing that we have seen fluctuations in healthcare costs across the board for years. And this has nothing to do with the pandemic. It was going on before then. It'll go on long after that. So with that said, I know that Blue Cross Blue Shield of North Carolina is always trying to keep their rates in a as best position as they can. As a company, how are you all reacting to the constant change in healthcare and trying to maintain affordable coverage for your customers?
Absolutely. That's a good question. There's just a lot of things that we do that would help us to lower those costs in negotiations with the price of going to the provider and things like that. Overall, throughout the state, Blue Cross this year has had a reduction in premiums. That won't affect every area, but overall there has been a reduction this year just because of some of the savings that we've been able to do through some prescription drug savings, through some medical care savings and different things like that. We're always looking for ways to manage and lower those costs for our members because it does get expensive. So we want to make sure that you have the best plan for the cost to be able to maneuver and be able to function with your family and be a part of that as well. So, each individual is a case by case basis. So if you have questions, you can always give us a call, stop in, so that we can go over that with you and see how we can help you save some dollars with, every little bit helps right now with the cost of everything just going sky high. We want to make sure that you have the best choice for your medical care as well, so you can take care of your family that way.
Well, excellent information from you as always on that, Wayne, and we'll kind of wrap that up here in a few minutes. But while we've got you, I want to continue to kind of see what you've got going on community wise. The Boone Center of Blue Cross Blue Shield of North Carolina, fairly new. You can still smell the new paint when you walk in the door, but you've got a much more interactive and easy to get to facility now that you're located on Highway 105. And I know that you do such a great job, and your team is always out trying to connect to the community. What kind of things do you have going on in that regard right now?
Absolutely, David. We got some great things going on, and we continue to work through some things to offer more. Right now, we are offering senior adult bingo on the second and fourth Tuesday of every month. That runs from 11 to 1. We just understand that there are times when senior citizens sit at home alone, no communication, no one to talk to. So we want to do this as part of a loneliness program. We don't talk about insurance. We don't talk about Medicare while they're here. In fact, you can't even ask us a question about insurance because we want to ask you to make an appointment and come back, or wait till after bingo and make an appointment. We can talk to you then. This is just a great time to fellowship and make new friends. We've actually even seen some of our senior adults exchanging phone numbers and email addresses so they can communicate outside. We're offering a veterans only bingo on the third Tuesday of every month from 11 to 1. And both of these bingos have free lunch. We're just getting started with the veterans bingo. We want to honor them and make them know that we appreciate the service that they've provided to our country, and we want to take care of them in our community. We got some things going on that we're looking to schedule probably by the first of the year, some yoga classes, some more exercise classes on top of that. We're partnering with the local rec center, the county recreation center, to do some things in the center with them that we're trying to get in place now. So keep an eye out with the rec center, because they'll be announcing some of those things that'll be going on here, and keep an eye on us as well. We'll be telling those as well. So just a lot of things. We're partnering with Hunger and Health Coalition to do some different things with food drop-offs and fruits and vegetables and different things like that. So those are still in the works, but just some exciting things that we're doing, because we recognize that a healthier community is healthier families, healthier workplaces. And so we're just here for the community. If you have a suggestion, something you'd like to see us maybe offer in our centers, give us a call. We're open to any suggestions of what the community wants. And we just try to build those relationships. We partner with a lot of nonprofits. We have a community center here that we allow the nonprofits to use for free. We've had board meetings, we've had retirement parties, we've had educational classes, we've had CPR classes, all put on by nonprofits, and they utilize our space. So it's a great time. We're having the business after hours next week here, so we want you to come on out for that. And we're going to be at the golf tournament tomorrow, so just be sure to stop by our table as you maneuver through the golf course and speak to us, and we'd love to meet you and share some things going on in our community.
Well, you teed up that last part, no golf pun intended, really well. Yes, golf tournament on the 6th of October, and then that business after hours coming up on October 12th. And if you have not had the opportunity yet to see this new space that Wayne's talking about, this is a great chance for you to walk inside the door. Very flexible meeting space. Again, Blue Cross Blue Shield of North Carolina has been so gracious in allowing a number of our nonprofits to use that facility for volunteer coordination meetings, board meetings, just about everything in between. So if you haven't seen the center, please come and join us for business after hours. Again, that's coming up October 12th from 5 to 7. You can register online for that at boonechamber.com. Last thing for you, Wayne, and you touched on it a little bit, that the value of these alliances that you've had. You mentioned Blue Cross, or you mentioned Hunger and Health Coalition as one of those community agencies, and certainly some of the events that you're bringing into the center. But you've been in your role for a few years now. For businesses that may be interested in finding partner organizations or staff outreach opportunities, can you kind of explain a little bit about what that's meant for you all establishing your footprint, establishing your brand in this community, to do that by assisting others? What's been the benefit for you to make some headway in building relationships as a company through that kind of unique way?
Yeah, so it's just all kinds of great benefits. First, it's building relationships, getting to know people who you wouldn't normally know. We've been able to share ideas with others. We've been able to recommend or tell some of our other folks about some jobs in the area and different things like that. We've been able to draw from the community for some of our jobs. And so really it's just about building those relationships, listening to our community and what they need, what they feel uh, the community needs from us, and how we can help. There's just a lot of things in the works that we partner with the Western Youth Network, for example. We built some great relationships there. And to plug another thing, we're hosting some trees this year for the Festival of Trees. We've supported them, and we just love them, and it's just a great thing. And I'd be amiss if I left out Amorum as well. Amorum Amorum is our nonprofit partner for the Business After Hours, and what a great organization. They're raising some funds for the community to build a facility for hospice, and that's just a great organization as well. And it gives us an opportunity to give back and to help them promote what they're doing, and to be able to take care of those who are in their last days. So it's just really, to me, the benefit of it is just getting to know the people in the community and building those fantastic relationships. The chamber's been one of our best relationships, and we just appreciate that partnership as well.
Well, we appreciate you guys, and appreciate you supporting us with these upcoming events. And, I tell people a lot when we have this conversation with businesses, they'll say, hey, I'm just looking to get our name out there a little bit. We need to drum up some business. And, if you're good about creating genuine relationships, the business stuff will take care of itself. But you'll find that you're so much more connected to the community by just being there to be a partner to folks, and being there to help folks in the unique ways that you can. So your center is a big part of that. So thanks for making that available to a number of organizations that are always on the hunt for space. Space is a premium in this community, so it's great.
And for our nonprofits, it's free of charge. We don't charge them anything. All we need to know is a date and time so we can make sure we reserve it for you. So it's just a great opportunity for those nonprofits to be able to utilize the space.
Well, that's awesome. Well, we promised folks contact information before we got out of here as we wrap back around to that open enrollment conversation. Again, those windows right around the corner for both those that are enrolling in Medicare, but also into the under 65 plans. If you want to hit the high points on that, give us the phone number, Wayne. We'll close it down with that.
Absolutely. It's 828-276-1294. 828-276-1294. We'd love to hear from you, and call and just ask us anything about those events and stuff that we've mentioned earlier.
Well, excellent. Well, Wayne, we appreciate you as always, and appreciate you always being willing to come on the program here and share valuable information for our community, especially as people try to get their heads wrapped around one of those important life events, if you will, and that is making sure that you've got the right health coverage for the year to come. So I'm sure we'll talk to you again soon. That seems to be our pattern. So until next time, always good to talk to you, my friend.
Thank you, David. Y'all have a great day.